Hello, I'm Lisa Thompson, and I am a Safeguarding Adult Review Chair, and I'm going to speak to you today about the Safeguarding Adult Review pertaining to the death of Nick. Nick was a 21-year-old young person who passed away due to multiple organ failure, hypoxic brain injury, and an insulin overdose. Nick's family described him as cheeky with a sense of humour, and Nick was creative and enjoyed crafting. Nick was assigned the female gender at birth, and at the age of 18, Nick requested he/him pronouns. In honouring Nick's request, the review used he/him pronouns throughout. Nick had a diagnosis of emotional unstable personality disorder, otherwise known as EUPD. Nick was also diabetic. However, since being diagnosed in his late teens, Nick had not been consistently compliant with his medication. It was identified that Nick would mismanage his diabetes and refuse to take insulin as a form of self-harm. Nick told healthcare professionals that since the age of 7, he had wanted to die, and diabetic mismanagement was his way of taking his own life. The Safeguarding Adults Review referral was made by Nick's father due to the family's concern that Nick had been permitted day leave from their inpatient psychiatric facility where Nick had been living until September 2021. Nick's father was involved in the review throughout. Kent Police first had contact with Nick in March 2016. There followed 12 police contacts that year, with Nick being named as a suspect. In August 2016, a referral was sent to Children's Social Care due to the concerns around his behaviour. Nick became a looked after child in November 2016 under a voluntary Section 20 agreement, and soon after was admitted to a mental health ward as an inpatient. At this point, Nick was 15. Nick remained an inpatient until September 2021, apart from a short period where he lived within the community in supported accommodation until he took an overdose and was returned to a psychiatric ward. By 2021, Nick's behaviour within the psychiatric ward had become problematic, and between February and September 2021, he had 15 contacts with Kent Police for assaults upon staff. Nick was also seen regularly at the local acute hospital due to self-harming and poor management of his diabetes. Nick invariably refused care for his diabetes. Various mental health capacity assessments were completed regarding his decision to refuse treatment, and at times he was found to lack capacity and was given treatment in his best interests. As his physical health improved, his capacity to refuse treatment returned, and he would become unwell again due to refusing treatment. In September 2021, it was agreed within a multidisciplinary meeting at the psychiatric ward that Nick's well-being was not being promoted by him remaining an inpatient. Nick was reporting that he did not want to be there and that his behaviour was due to the constraints put on him in the controlled environment. A decision was made to discharge Nick into the community, into supported accommodation. However, it was not possible to find a supported accommodation provider who would accept Nick due to his violent behaviour and complex needs. On September 2021, Nick was discharged into the community into an unfurnished property accommodation flat. Nick's social worker had not been involved in this decision-making or in plans regarding a package of care upon discharge. Following discharge from the inpatient ward, CCAM were called to Nick on numerous occasions, and he was often found to have high ketones and was either treated at the scene or taken into local acute hospital. Nick continued to express suicidal ideation. On the 10th of October 2021, Nick was taken into the local acute hospital, where he remained until February 2022. The learning disability nurse, liaison psychiatry, the safeguarding nurse and the hospital legal team continued to liaise around Nick's care and mental capacity. There followed ongoing sporadic refusal of treatment and sporadic episodes of violence towards staff. On the 5th of November 2021, a multidisciplinary team meeting was held. It was recognised that if Nick wanted to leave the hospital, there was no legal mechanism to keep him there. The social worker shared their concerns with the multidisciplinary team about Nick being discharged back to his flat, as this was on the second floor and the community mental health team had not yet completed a risk assessment. A plan was made to keep Nick in over the weekend and allow his discharge destination to be risk assessed. Following the meeting, the matron spoke to Nick and he agreed to stay in the hospital if the registered mental health nurse was removed from observing him. This was agreed with a plan for a 30-minute check instead by the nurse caring for him. Following this discussion with Nick, he continued to refuse care, and at 7 p.m. that evening, Nick suffered a cardiac arrest. 5 days later, Nick's father updated the social worker that Nick was now on a full life support machine, and the family had agreed to a do not attempt resuscitation. Nick remained intubated and sedated. Nick passed away in hospital on the 11th of April 2022. The full Safeguarding Adult Review report is available on the Kent and Medway Safeguarding Adult Board website. The following themes were identified through the learning of the review. First of this being gender identity. Nick's gender identity formed an important part of his experiences. He was living in the psychiatric ward on a female-only ward, and records indicate many instances of misgendering which may have caused him distress. Some of the questions you can ask yourself are, do you feel comfortable asking for preferred pronouns? Does your organisation request preferred pronouns on intake forms and during intake interviews? Is there space within your intake forms or on your case management system to record preferred pronouns and or gender, as well as biological sex? If not, are you able to record this information within a notes or free typing section? Do you understand what is meant by gender identity, and do you know where to find this information? A further theme that was identified was trauma-informed approaches. Nick had experienced traumatic events in early years, and as a young person, his behaviour was potentially a result of these experiences. It is important that systems and practices are trauma-informed in their approach. Some of the questions that you can ask yourself are, does your organisation offer trauma-informed training to help you in your particular practice? And if not, do you know how or where to access training external to your organisation? Can you think of a client or a patient who may have behaviour which stems from trauma? Can you reflect on how you have overcome any challenges presented within your engagement with that person? More generally, could you make small changes to your practice, such as asking what happened to you instead of what is wrong with you? And finally, a theme was identified around recognising emotionally unstable personality disorder, or EUPD. So Nick had a diagnosis of EUPD, which is characterised by pervasive instability of interpersonal relationships, poor self-image, mood, and impulsive behaviour, with particularly strong tendencies towards suicidal thinking and self-harm. It is important to recognise this when responding and supporting people living with EUPD. The review recommended that practitioners should understand how emotionally unstable personality disorder may present in individuals, for example, in the form of self-harm or apparent self-neglect. Some of the questions you can ask yourself are, what do you know about EUPD? And what policies does your organisation have around self-neglect or self-harm? How do these policies help you when you are responding to a person living with EUPD through your role? And where would you go to access training or advice about how to better support people with EUPD? I hope you found this short video helpful. Thank you for listening.